representation up in Edmonton, but we work across Alberta and actually across the Prairie provinces. I'm going to give you a bit of a crash course from the international level about human rights. You have a copy of the presentation on your table, but I'm going to give you a quick crash course, and why I think this is important is I think when we're talking about human rights, we always, in my mind, have to start at the international level. We have to start at the international to understand what are those standards and what are those guidelines or ideals that we're striving for within our local communities and with our province in Canada. So when we're talking about human rights, and when the United Nations talks about human rights, they usually talk about it in the 3 Ps. They call it the provision, protection, participation. So everyone, when we have human rights, when we want to think about it holistically, everybody, one of the pieces, that provision of the necessities of life is one of the core elements of human rights. That it connects to the idea of the security of the person. The other P about protection from the violation of others is this idea that we have this freedom to be in this world, but to be protected from harm from others. We can get into conversation about where those boundaries are when we start talking about, freedom of speech and that, but really we have the right to our own belief systems, all these things, but we have also a right to be protected from other people violating our rights. So the whole intention is to create a social space where we can live and work together, and we're all kind of free to be our own person. The other one that the UN talks about is participation. This is a really big one, and one where Canada has actually received kind of some failing grades at the international level around how Canada engages civil society, people, in conversations on issues. So participation means that we all have the right to participate in decisions that affect us. Whether it's we're in the doctor's office, or whether we are voting in an election, or whether we're engaging with a local bank, we all have that right to participate in these decisions that affect our lives. That is a fundamental element of what human rights are. But one of the areas that we feel misses in the UN discussion about those 3 Ps is the space of remedy. To be able to have rights, we need to have spaces where we can remedy or rectify the situation in the event that they're violated. If we don't have that, if we don't have spaces where we can actually claim our rights or raise complaints or concerns about our rights, then we have no rights. Because really, if you don't have a space for accountability and remedy, then we're missing the boat altogether. Now, there are a lot of really great places and formal mechanisms for remedy. We're going to learn about a lot of those today, and we're going to talk about them. But when we think about human rights, you can think about it as 4 quadrants of thinking about those are the four kind of holistic elements of what human rights encompass. So when we talk about the human rights and health, there's a number of different international conventions that kind of define the international right, like the right to health. However, from the World Health Organization, the way that they would define it is, it's understanding health as a human right creates a legal obligation on states to ensure access to timely, acceptable, and affordable health care of appropriate quality, and we'll talk a bit more about that, as well as to providing the underlying determinants of health, which could include potable water, sanitation, good housing. So this is kind of how it's been defined at this international level. It's about access, and it's about those underlying determinants of health. So I mentioned Canada is party to about 7 international treaties, including the International Covenant on Economic, Social, and Cultural Rights, which kind of frame out this right to health. So for example, and when we talk about conventions, at the international level, conventions are internationally legally binding documents. So when a government like Canada signs on and ratifies these treaties, we're actually making an international legal commitment that we're going to strive to realize those rights within that convention. So this is important to understand because it's those documents that set the framework and set the standards for us as community members to be able to hold our government or the stakeholders in Canada accountable. So they are the standards that we should be aspiring for. Can you hear me even put that up? Yeah, sorta? Okay, I'll just talk really loud. So Canada has signed on to these conventions, and it's important for us to understand that. So when we are striving for our rights, being able to use the language from these international documents helps us strengthen our case. And there are also human rights remedy However, there is a protocol that Canada has not signed on yet that won't allow Canadians to go and to submit complaints when it is in the relation to the right to health. That's something I think we need to apply pressure on. And there was recently a visit to Canada by the United Nations Special Rapporteur on health. Very interesting report, and I'd be happy to share that out after. But the largest outcome of that report was, yeah, Canada's doing okay, but Canada really needs to apply like a rights-based lens to looking at healthcare, and that means that it's about ensuring people have that right to participate in those decisions, and to really make sure it's coming at a holistic approach. So Canada is working there, but we've got a long way to go according to the United Nations. So the right to health kind of includes freedoms and entitlements, and just really quickly, freedoms include the right to control one's health and one's body. So for example, your sexual or reproductive rights, and to be free from interference. So free from torture, from non-consensual medical treatment and experimentation, and then the entitlements around health. I'm sorry, I think this microphone. Include the right to a system of health protection that gives everyone an equal opportunity to enjoy the highest attainable standard of living. So we're entitled to this system, but we also have the freedom to have that autonomy and sovereignty over our own body. So what is a rights-based approach to health? I'm just going to run through these slides quickly, and I'll wrap up. But for when you're starting to apply a rights-based lens to health, and this is what the United Nations was saying to Canada, is that really the most important thing in applying a rights-based lens, you should always be kind of focusing on the most vulnerable or the most disadvantaged populations in the community. When you look at strengthening the health and supports available to those that are most marginalized or excluded in a community, it actually strengthens for all. And so a rights-based approach is really grounding in that approach of really understanding who's the most marginalized and how do we work to move forward. Some core principles of human rights and a rights-based approach that guide a rights-based approach is one, accountability. And I've talked about that in terms of having spaces for remedy, but it's also accountability of our government or our stakeholders who are responsible for providing health, that we should have that capacity to hold them accountable. And ensure that there's that reciprocation between the state and the community. Equality and non-discrimination, meaning that everybody, no matter who you are, no matter your race, your gender, your identity, whatever, should have access to health equally and not be discriminated in that. Participation, I've already had some conversation about. Universal, indivisible, and interdependent. The core principle there is that, as I said, rights belong to all of us, but rights are indivisible in the sense that if you don't have your health, you can't have all these other rights. The violation of one right will affect your rights in other areas. It could affect your right to work. It could affect your right to go to school. It has all these elements. So it's understanding that rights are indivisible. The other core principles, the two that I think are important to highlight here, is this idea called progressive realization. So when Canada, for example, signs on to an international convention around human rights, what Canada is saying is that we agree to progressively realize the rights within this document. And that means we are going to strive to always get better and better and better. We realize that we can't maybe have all of those rights right now, but it's that the state makes a commitment to continually improve human rights. And that leads to the next principle, which is non-retrogression. And this is the idea that when a state signs on to these documents as well, that a state can't go backwards. We shouldn't ever go backwards in the access to health that we have. So for example, if a specific community, say the transgender community, for example, had access to health at one point and had access to certain supports within the health system at one point, we can't kind of take that away. We have to, this idea of progressively realizing that also we can't make, things should never get worse, they should always be getting better. So that's an important principle in terms of the international standards of human rights. So then finally, quickly, four kind of core elements of components of the right to health. One is about availability. So what that means is there's a need for a sufficient quantity of functioning public health and healthcare facilities, goods and services, as well as programs for all. so that there should be an availability of these health supports to all people. The second core principle is accessibility, which requires that health facilities, goods, and services must be accessible to everyone. And that has 4 dimensions. So non-discrimination, so it should be accessible no matter what your background, your experience, or your identity. There should be physical accessibility. There should be economic accessibility. Affordability in healthcare is a priority within accessibility rights. And then there's information accessibility. And that is this idea that you have the right to the information on your health. And having that access to the information on your body is a critical element to the right to health. Third principle is acceptability. So respect for medical ethics, being culturally appropriate, sensitive to gender. It requires that health facilities, goods, and services are people-centered and cater to the specific needs of diverse groups. It's recognizing that one community, say for example those living with physical disability, have a totally different definition of what acceptability could be versus say somebody who's able-bodied and cisgender white female, for example. There's different acceptabilities in different communities. So the idea about being people-centered is that the health system needs to be able to work with the individual and work outwards and not put a blanket approach on everyone. And then the third piece about the right to health at the international level is that health services should be safe, effective, people-centered, timely, equitable, integrated, and efficient. So there's a quality element to right to health. So to sum that all up really, really quickly, if we're thinking about Lethbridge, an area as a human rights community, a human rights city, let's call it a human rights city, what would that mean if we were talking about health? We define Edmonton as a human rights city. It's been a project we've been working on for many, many years, but we define it as a city where all belong, are valued, and participate. But when we think about access to health, the way that I would define a human rights city in terms of health would be one where all can access timely, acceptable, and affordable health care of appropriate quality. One where one can access remedy when there's a challenge to human rights. One where people can participate in decisions that affect them in the health system. And one where all people have access to those social determinants of health. So housing, food, for example. So those, if we think about how these international standards should define and frame our discussions about health, this kind of gives you a quick snapshot overview of the international standards and what we should be striving for in our communities when we start to talk about health and mental health.